So, without further ado, I want to introduce Melora Jackson, who is with us this morning. She is with Second Wind Dreams, and she is the clinical manager there, and she's going to be talking to us about resources that Second Wind Dreams offers, just in case you haven't heard of this wonderful organization, as well as some really great tips and tricks for managing caregiver stress during this unprecedented, stressful time. So, without further ado, I want to welcome Melora and turn the mic over to her.
Thank you, Leslie, and thank you all for having me. I'm honored to be here and talk with you all today. As Leslie said, these are unprecedented times, and we all know caregiving is a challenge in the best of circumstances. So it's a particularly difficult time, and hopefully we can give you some tips today on how to manage your stress and during these times, and also let you know about things we do at Second Wind Dreams and ways you might be interested in participating in that. All right. Well, I want to start off with a poll. If you could move it to the poll. Oh, wait. Oh, I guess the poll is later. Excuse me. I got my slides mixed up already. I'm so sorry.
I can do the poll if you would like. I'm sorry.
No.
Okay.
No. You're
Gotcha.
right. I'm wrong. I had in my notes backwards. Sorry. So my apologies, everyone. Second Wind Dreams is an internationally known nonprofit organization that is dedicated to changing the perception of aging through a few different ways. First of all, the fulfillment of dreams. That's our hallmark program is the Dreams program. And then also, we have a tool called the Virtual Dementia Tour, which is a sensitivity training to help people understand what it's like to actually have dementia so that they can be more empathetic and do a better job in care or relating to people with dementia. So what you see here on this slide is some different logos, different programs that we have. The Dreams program, the Virtual Dementia Tour, and some other programs that are related to them. And I'm going to talk about them in a little bit more depth, most of them in a minute, but I want to just highlight a couple the DACE. I'm not really going to talk about that today, but DACE is a measurement tool for professional caregivers used in healthcare settings, but it could be used by a family caregiver, I suppose. And it's designed to help patient-centered care. So we can evaluate the care, direct care give, and do training or other type of intervention, and then test them again with this tool to measure behavior and how it changes as a result of the training. So it's an exciting way to see if we can actually affect change. And the results we have found thus far over the years have been very positive. So we do know it's an effective tool. The other thing I want to mention on this slide very quickly is nursing home grant. We have in several states something called Civil Monetary Penalty Fund grants, which are projects that we do in nursing the civil, they call it CMP for short. And basically what that is in simple terms, when a nursing home does something that shouldn't and gets fined, and it could be something small or it could be something big, they get fined and the money goes into a pot. And this CMS administers, but each state has their own pot of money and they can decide who to lend it out to. And that pot is designed for retraining and interventions to help improve care. So we have applied, and you don't have to be part of the nursing home to apply. So we have grants in several states to do the Virtual Dementia Tour with this DACE tool I just mentioned, and to help lives of the residents in those nursing homes. So we are in right now. We are in the application process for Florida. So if you want more information about that, as well as all of our programs, of course, you can go to our website and we'll give you that contact information at the end. But that is something that we look forward to beginning that project in the state of Florida. It's so desperately needed. Okay, next slide, please. So the Dreams program is really our flagship in terms of helping people understand that you're never too old to dream. Second Wind Dreams was recognized as the first stage to focus on enhancing the quality of life for elders and changing society's perception of aging by making elders' dreams come true. So our award-winning Dreams program is a powerful way to connect society to a forgotten truth about elders. And that truth is that age does not erase dreams. Second Wind Dreams was founded in 1997, and since then we've fulfilled over 10,000 dreams, and that's about 6 dreams a day. They come in 4 different categories that we put dreams into, and we focus primarily on elders who live in long-term care. So dreams that are adventure, that could be, we've had people who want to go skydiving or ride a camel or fun things like that. We've had reliving past experiences, perhaps real ceremony or a date or some event in their life, a con or something like that. We have family and love. Those are often with family in some way, or getting to see children one hasn't seen in years. And then heart and soul involve anything from a hobby to all kinds of different things. Okay, next slide, please. Next slide. Okay, I'm sorry. The Dream Impact Study was a study that was done around 2002 by P.K. Bevel, who actually founded Second Wind Dreams and created this program, as well as the tour. And in this study, she looked at 3 different elder care communities. And I won't bore you with all the minutiae of the study, but they did a lot of pre and post measures and looked at fulfilling dreams and what impact it had. Because fun and a nice kind of a fluff thing, there's really some behind it. The rate of depression, as you can see in these numbers here, decreased incredibly, very significantly for a lot of people. For a few, there was an increase in depression. We're not sure why, but I suspect some of it has to do with calling things happier times and being unhappy with their situation. But overall, most people were improved. We also saw staff improvement, teamwork, and more personal care. As these dreams are fulfilled, the staff came together and worked with our community. So we do know these have an impact. Okay, next slide, please. So one of the other programs under our Dreams department is something called Gifts of Light. And we've all heard of the kinds of programs or angel trees and things like that. And this is very to that. We call it our winter holiday gift program because we want to make sure we honor people of different faiths and backgrounds. But we work to gather presents, and sometimes they're just little things, but we get groups, volunteers and groups to donate, shop for gifts, and for many of these elders, that's the only gift they get. The folks who are receiving these primarily don't have family that visit or anyone nearby or anyone to connect with. So we make sure that everybody gets at least one gift over the holidays. Try to get them delivered on the holiday or the day before rather than earlier in the month, because like Christmas or Hanukkah or whatever it is for that person. Next slide, please. So the program that I'm really excited to tell you about is our Cards of Light program. And this goes on all year long in terms of holidays. We use all kinds of different occasions. It can be kind of a thing, or it can be tied to something like Valentine's Day, Mother's Day, Father's Day, whatever. Since we're in this COVID-19 situation, people are more isolated than ever in elder care communities. And so Brenda Reeves, who is our National Outreach Coordinator with the Dreams program, she heads this got going now this spring and may go on into the summer. It's been going on for 2 months now and will continue definitely. And it's what we're calling the Luminary Challenge, where we ask individuals to make or buy 5 or 25 and 4 groups to make 50. And they get sent to an elder care community that has registered. And so the cards are made to go to staff and elders who live in the community to let them know that they're not alone. We've had over 500 people already participate, and we've had 1,000 cards already in just 2 months come from different people. So a lot of groups enjoy doing this. A lot of kids who are at home, out of school, have taken up the challenge. Teenagers doing it, community groups, sometimes even nursing home or assisted living who choose to do it during communities. So there's lots of different ways it can happen. So if that is interest you, we would be more than happy to have you participate. It's very, very easy. You simply send an email to Brenda, and you can see her email there. And she will send instructions, and you simply make the cards, put them in one large envelope, and send them to the contact at the particular elder care community you the information for. And so it's very simple. You don't have to put individual names on the cards. The contact person there will dole them out. But it's a wonderful, rewarding, and easy program, activity for people, and it makes such a nice light in the world for these folks. For many people we visited in nursing homes who get a card, whether it's through this Luminary Challenge or at any time, we've got at some nursing homes or assisted livings even, and seen the card taped up on the wall and maybe come back a year later, and that's the only thing that's still there. They often don't get much else. So this is a great way for them to know they're not forgotten. Okay, next slide, please. So I'll tell you about the virtual dementia tour, and this is a tool that we have, and it's something that I think that everyone can benefit from. It's a tool to actually experience what it's like to have dementia. We have trainers all over the world that do this. We have several wonderful certified trainers in Florida, and many program users who have the tour. It comes in different formats, and it's one of them, which I'm going to talk about in the family edition, which is one that is self-directed that you can do in your own home. Okay, next slide, please. So this is a scientifically proven method of demonstrating what it's like to have dementia, and it's a full immersion type of simulation. We'll hear virtual dementia tour and think it's virtual reality, but it's not. The term virtual dementia tour, when she was doing research and started to develop this in 2001, PhD thesis, and it grew from there. And so there's much research on it, and continues to be done, but that was before we actually had virtual reality. It does involve all of the senses, and it involves tasks and being given some instructions and getting a sense of how it affects all of not only your senses, but how it affects your brain. And when a person goes through the virtual dementia tour, it actually has an effect, altering a person's ability to perceive and understand the world around them, which simulates. Next slide, please. So here's just a few demographics about it. I won't bore you with a lot of statistics, but over 3 million people around the world experience the virtual dementia tour. It's been used in 20 different countries. We have currently 5 international partners, and in those countries, those partners do it for all across their country. So we've got it in Australia, Italy, the whole UK, Canada, Israel, and we're hoping for more countries as well. We've had over 1,000 healthcare facilities that use it as part of their training. We also have a lot of universities, medical schools, area agencies on aging, all kinds of folks use the virtual dementia tour as a tool for training healthcare staff to better care for our. Okay, the next slide is it's a 60-second video. Lisa's connection, if you can pause it so it doesn't start. Lisa's connection, if you all know Lisa Gibbons from it was on Entertainment Tonight. She has some day programs in California and in South Carolina in honor of her mother who has dementia. And she's a big fan of the virtual dementia tour. So programs in California, they made a 60-second video about the virtual dementia tour. It gives you a good glimpse into the healthcare version of this tool. So if you'll go ahead and play it, then I'll talk about it. Okay, so that gives you a glimpse of what the equipment and just like without giving away all the secrets of it, because there's some things we don't want people to know and experience it. But it is a tool to help you understand what it's like, and also to figure out what you can do as a care partner for a loved one to change the way you behave and the responses you get from your loved one, and make it a little easier to take care of them. So the family version that I is a self-guided experience. All the instructions are embedded in a soundtrack. It comes with the little program comes in a box. It looks a little bit like a catering box, and it's designed to look like a home. But everything you need to do it in your own home is in this self-guided version. So it's got a little MP3 player that's got everything in there with the instructions. It's got the task items that you need, the equipment. There's gloves, shoe inserts, a variety of things, and a booklet, which is one of our pieces of all of this, that goes with it, that talks about what you experience and what you can do differently to help care for your loved one more effectively and have a better experience. And sometimes it helps relieve some of the guilt some people have of things that they're doing wrong that they didn't realize they were doing wrong. And it's so there's that version. That one is right because of COVID, we're trying to offer that as with a discount. So on our website, if you go to our website, and you'll get that information at the end, you can see there's a discounted price for that right now. Okay, I'm sorry. Go ahead. So we have a poll here. Now is one poll. I wanted to ask, just get a feel for your stress level and your experience so far with COVID-19 and how that. If you could take a second and just answer this question: has COVID-19 pandemic impacted your care for your loved one? Give it just one more second to chime in. Okay. So it looks like it's had some impact responded. We don't have a lot of respondents yet, but and for you a lot. Yeah. Okay. Now, if we can go, we have one more question. And this is, how much has this pandemic actually impacted your stress level? Okay, so we're getting a lot across the board, a lot. Okay, that's not surprising to me at all. It's impacted all of us in some way or another, that's for sure. But I'm sure as a caregiver, it can be extremely stressful. Okay, so if we can move forward beyond the poll.
It's take. Oh, there it is.
It's stuck. Okay. I could always keep talking about it, but I don't want to. I want to bring it. Okay. So some of the things that happen in the virtual dementia tour, some of the key points that we want to emphasize giving as a result of the tool and is some things we can do differently. One of them is to make sure that we're giving some control back to that person with dementia, because behavior will occur because that person doesn't feel like they have any control. And it's difficult for that family caregiver sometimes. So finding simple ways that we can give control back to that loved one with dementia. And it could be as simple as offering a choice, even if that person isn't capable of making a choice, saying, for example, when it's time to wear the red shirt or the blue shirt. And even if they can't ask you, or answer you rather, being able to offer that to them gives them a sense of control. But if there's things they can do for themselves, and encouraging them to do that, that can help. Another is to design care tasks and activities to be basically failure free. There's going to be some success. That can help a lot. Also, as familiar as possible. And if you've been taking care of somebody for any length of time at all, you know that routines are and familiar things are really, really important. Making sure, of course, and this is stuff that you all have heard many times, but concrete choices, making sure they're visually clear, making common say now with this pandemic, our own stress level affects our loved ones. And when we pick up on things, we don't even realize sometimes, and they will be very, if you're experiencing stress related to this pandemic, you may be a little bit more on edge, you may be a little more irritable. They're going to pick up on that. That's going to affect their behavior, and it's going to begin a vicious cycle and a spiral down. Making sure you're creating calm and safety, and taking care of yourself so that you them calm. Be encouraging, reassuring, obviously. Giving people things to do, of course, is important. Taking cues from them, making sure you're paying attention to that person and adjusting your behavior accordingly, and adjusting your time expectations. So these are some of the kind of general recommendations I always make after the virtual dementia tour. Next slide, please. And these are things that you need for your stress level, especially now. Now, of course, these are things you want to do all the time, but these are really important now. And one of them, of course, as I said, is maintain those daily routines. If you have somebody with dementia, you already know that this is important. But when there's situations that are beyond your control, those daily routines are something you manage. And that consistency will help keep your loved one calm and more secure feeling. Another thing you can do is focus on the things that you can and try to avoid that what if thinking. There's a lot of really scary news right now, so limit that excess yourself as well as not letting your loved ones see it, and concentrate on those things you have control over. Plan for your older adults' care in case you get sick. Forbid, and I hope it does not happen to you, but now I'm not just speaking of the pandemic, I'm speaking of any time. Having that plan if things change dramatically very quickly. Make sure you have a plan of action. Take some mini breaks throughout the day. I know we're always being told, put that oxygen mask on yourself first, take care of yourself, do things for yourself. And it's easier said than done. But sometimes it's 5 or 10 minutes. Sometimes it's locking yourself in the bathroom and lighting a candle and looking in the mirror and telling yourself you got this. It might be something simple as playing a quick little song. Certain things like this webinar, this little timeout. So sometimes you have to challenge yourself to be more creative, especially now that you can't get out and about as much. So try to find ways at home you can take just tiny little breaks throughout the day. Also consider what that person with dementia is, that the virtual dementia tour can help you, is to give you a better their eyes. But even without that, thinking about what that person might be experiencing and how things might be perceived by them. For example, facial masks to protective masks, that can be an issue. And how do we even explain that? That's very important to consider. You already know, as caregivers, you need to be flexible more than ever now. Be as flexible as Gumby. You really have to be that flexible sometimes and go with the flow. Watch your body language and tone of voice. Again, if you're not feeling in control, if you're not feeling calm, and because of this pandemic, it's going to show, and it's going to affect their behavior. Thoughtful use of technology. With all this social isolation, there's a big usage of, video conferencing, web tools, using different things like that to connect with friends and family. And that's fantastic. But sometimes for that person with dementia, they don't understand that person on the screen, or that it's not real. And it can become more stressful than not having it. So sometimes a phone call is better than a web call for a person with dementia. It just depends on your loved one. And also think about, and you've probably already been doing this, plan the responses to those questions about masking and social distancing and so on. Try to keep it simple and not a complicated answer, because as you know, you're going to wind up repeating it, but you also don't want to make it scary. So saying things like, well, there's been a bad flu, or a lot of people have been getting sick, and we just want to take extra precautions, or something simple like that. Okay, next slide.
Hey, Melora, this is Leslie. We only have a
Yes.
couple of minutes left, and I want to make sure we have time for questions. There were a couple that came in while you were talking. So I'm going to unmute folks. Susan Poplin had a couple of great questions regarding masks, and then also the virtual dementia tour. So Susan, if you want to unmute yourself, you can ask those questions, or I can do it for you, whichever you prefer.
Sure.
Susan, you should be unmuted now. Well, for whatever reason, Susan's not coming through, but her first question was about the virtual dementia tour. She wanted to know if there's any special equipment needs and the cost involved, and can it be done free? Is there what are the options for that?
Yeah, so yeah, there are definitely costs involved, and it depends on what type of organization or individual you are, and what the audience is. We have a community version that program users can have, that it's always free to the participant. No version of the virtual dementia tour should no participant should have to pay to go through the tour. However, having the program costs money. There's different versions for organizations. There's different levels depending on where they want to use it. For the information on that, if you would you'll see our website at the end on the slide. Go to that website, and there's information about it and summary of it. So the family program that you can buy, that's self-directed, is $150, but right now there's a $10 discount on that. The organizational versions are significantly more, but they come with a lot of training and the ability to use it in a lot of different ways in terms of staff training. So if you'll go to our website, or you can contact me afterwards, and I'll be happy to talk with you about that. Let me just say something real quick about the mask here, and then I'll let you ask questions. And I know you can't read that slide, but one of the things that we're working on now is we've got directions on how to do a dementia-friendly mask, so people can get those cues that they might miss, just like somebody who's hard of hearing. And so that's another initiative we're working on right now. So anyway.
Super, thank you. Because that was the next question. Not just the stress, but the fatigue that comes along with this. And then the question that keeps coming from a loved one is, why are you wearing a mask? So that.
So yeah, I think again, the simple answer is that there's been a lot of people sick, and we just want to stay safe, or something like that. Your loved ones better than anyone. So finding the magic words for them, but keeping it very simple and upbeat and minimizing the stress. This particular recipe you can't really read on here. We can send you if you'd like. Is how to make a dementia-friendly mask. Works for people with hearing impairments as well. And there's directions to do it without actually having to sew, which is great for people like me. So we can certainly provide you with that.
Oh, fabulous, because that was the next question. Is there a guide to how to make the masks? So we'll make sure to get that out to everybody on the call.
Absolutely. I will send that to you last time. We'll make sure everyone gets that.
Super. Thank you. Before we sign off, I want to thank you for this wonderful information that you've provided for folks today. I invite everybody to go to the website to learn more about the different programs and about the virtual dementia tour. I know we've seen it a few times here in Tallahassee, and I know Vicki Rose with the Memory Disorder Clinic is on the call as well. I know they have worked with you, Melora, on that dementia tour, so we'll be sure to share that information with folks who may have additional questions about that for sure. And we'll share your contact information and the website with folks on the call. I will make sure to get all of those resources out to everybody today. Before I sign off, I know we've run a few minutes over. Did anybody have any other questions that I did not get to, we didn't get to answer today? Okay. Susan was asking about the link to the dementia-friendly masks. We'll be sure to send that out to folks on the call, Susan, so we'll make sure everybody gets that for sure.
Absolutely.
And then for people who are not able to participate live, this is being recorded. We will put this on our website for folks to share with others as well, because we want to make sure people know about the information and resources that are available. So, Melora, I thank you for being with us. Thank you for your time. Thank you for your expertise.
Well, it's my pleasure. Absolutely. Anything I can do to help.
Thank you so much. And thank you, everybody, for being on the call. I appreciate your time today. Stay safe, stay healthy. And next week on our call, we'll have Vicki Rose from the Memory Disorder Clinic and Laura Copeland from the Department of Elder Affairs. They have some incredible resources and cool things that they are doing in response to coronavirus for caregivers. So stay tuned. Thank you all and have a wonderful day.